Hello, everyone. Um,
Hi.
Hi, Laura. Nice to meet you. Uh, Anika? Anika, is that the right pronunciation? Okay. Hi, Peter Adok, Professor. Good afternoon.
Hi, everyone.
Hi. Emily, are you there? Okay. Are we live or this is just for check-in?
No, we are live, unfortunately.
All right. Okay,
Live.
super. Okay.
Hello?
Yes, Professor Adok, we can hear you and we can see you.
Thank you very much.
Yes, and I think as people join, moderator, do we give them 5 minutes? Maybe we get the consent of all the other people. I see the fourth speaker has joined. Dr. Betty has joined. So we have everybody here who must be here. And now it's up to us to get the consent of everyone to see if we wait for 5 minutes for some people to join or we just start right now.
Okay. Welcome. Steve, Sangwen. You are
Yes, so we can now get started. Can everybody hear me?
Yep.
Yes, loud and clear.
Good, so and I'm starting a recording. Okay. So good afternoon, good evening, good morning, wherever you are. We believe different people have joined this from different places or intend to join from different places. We saw a number of people had registered for this webinar. This is the second part of our vaccine advocacy series that we started last week on Friday. And the first part ended, and now we are the second one on vaccine financing. If you need to know the details, you can catch part of it on our Facebook page. That is South Sudanese Women in Medicine. But before going further, I would like to switch on my camera and introduce myself. My name is Koiti Emily. I am the co-founder and executive director of South Sudanese Women in Medicine. And my role is to briefly just talk about what Sswim is. In one sentence, we are women who just believe that when women lead in health, communities thrive. And we are female medical doctors, pharmacists, and dentists of South Sudan. And if you want to know more about us, you go to our Facebook page. You can also go to our website, www.sswim.org. Yes, Prof, we can hear you, but I will keep you muted, and then you will unmute when the moderator will have invited you to speak. So having said that, this is the second of our vaccine advocacy series and a project that we are implementing on ensuring that our communities across South Sudan know about the two newly introduced vaccines, that is the pneumococcal conjugate vaccine for pneumonia and the rotavirus vaccine for diarrhea for children, especially under 5. And these vaccines were launched on the 27th of May, and we participated in trying to ensure that there were a number of activities that took place to prep the population to receive these vaccines. And so part of what we are doing is a build up on the work that we have done in the past prior to the launch and even after the launch. And so we are having this series of conversations with this second one that is under the theme, Who Will Fund the Future? And the webinar moderator will talk more about it. I do not want to usurp his role, but he will talk about what this is about. He will introduce this webinar much better. Now, just for ground rules as we proceed, it will be good that as each person who is a speaker speaks, should please, if your bandwidth allows, to switch on your video as you speak and stay muted when you're not. That this is now for all participants and the moderator and not the moderator and the speakers to really just mute your microphones when you're not the one invited to speak. That way we do not get interruptions. And finally, thank you very much, all of you who have joined, those who are watching us live on YouTube and others who are logged in right here on Zoom. So over to you, Dr. Kemish. Oh, and before I go ahead, I am supposed also to introduce you, our dear moderator, Dr. Kemish. Ladies and gentlemen on this call, Dr. Kemish, as you might have read on we shared this morning a flyer about him, but if you did not catch that on Facebook, Dr. Kemish is a research scientist with the Center for Humanitarian Health at the Bloomberg School of Public Health, Johns Hopkins University, and he serves as the managing director of Juba Strategic Consulting too, a South Sudanese-based research firm dedicated to improving health outcomes through cutting-edge research and evaluation practices, while driving localization through capacity building of local researchers. And additionally, Dr. Kemish is also a co-founder of this organization that has convened this webinar, South Sudanese Women in Medicine, and is an associate member of our board of trustees, where he actively supports the empowerment and advancement of women in the medical field. He is also a commissioner on the CHH Lancet Commission on Health, Conflict, and Forced Displacement, which works to rethink and reimagine the humanitarian system. Welcome, Dr. Kemish, and over to you. You can take over with moderating this webinar. Thank you.
Thank you so much, Dr. Emily. It's a pleasure to be here and moderate. My job is simple. I'm going to ask the questions. Happy to be here. I want to welcome all our audience, those joining on Zoom and those joining through the other social media platforms. You are welcome to today's discussion. As Emily has mentioned, this is the second in a series of webinars that is being done to foster knowledge exchange and also advocacy to create awareness, basically for the two vaccines that have been recently rolled out. That is the pneumococcal conjugate vaccine and the rotavirus vaccine in South Sudan, but also generally about immunization in the country. So today's topic is a very important topic and talks about the money, right? So financing immunization. Who has been paying for our vaccine, for example, you may ask. How are we going to pay for our vaccines moving forward in the coming years? These are very difficult questions that I don't have the answers to, but we have a formidable list of panelists that are going to break this down for us. So sit tight, and if you have any questions as we go along, as Emily has said, we shall have a Q&A towards the end, where we shall give opportunity to you to ask your questions. Especially, I think it's easier for those who are joining on Zoom. You'll be able to ask your questions. Unfortunately, if you're joining live stream, you may not be able to ask your questions, but hopefully we shall answer your question along the way. Also, if you don't mind, you can put your questions in the chat as we go along and be precise and direct to the point. Don't beat around the bush. So I think vaccination is very important and to all public health professionals. And this is one of the most cost-effective ways, public health measures of reducing childhood morbidity and mortality. The cost benefit return is huge, and the recent analysis has shown that for every dollar that you invest in vaccinating a child, the return is massive. It's up to 16 USD. So I think it is a worthwhile topic to focus on, and I think I'm glad that there are a lot of interest in hearing about this topic. And today we are going to touch the real meat of the issue: is how do we fund vaccination in the country. So without further ado, and I think you already know the ground rules, please stay muted, and I'll be in control for the next 1 hour. I'll be able to unmute, ask you to unmute if I want you to speak, but otherwise stay muted, and we'll be listening to our panelists. Okay, so let me go through this list of introduction of panelists. We have four, and I'll go in no particular order to introduce our panelists for today. I'll read out their bios. It's a bit long, but please bear with me. These are very important. The first one is Miss Anika Islam Marshall. Is a public health professional specializing in health financing and immunization. She currently serves as a senior manager at Gavi, the Vaccine Alliance. As an immunization financing and sustainability focal point, she supports countries' ability to meet timely co-financing obligations and successfully transition from donor support. Anika has extensive experience collaborating with government agencies, intergovernmental organizations, NGOs, civil society organizations, and academic institutions, bringing a diverse and inclusive perspective to global health challenges. She holds a Master of Public Health from Johns Hopkins Bloomberg School of Public Health, specializing in health systems, health financing, and vaccine policy. Anika is also currently completing a PhD at the London School of Hygiene and Tropical Medicine. Our second speaker is Miss Laura Elisama. She's a bilingual health economist, public finance expert, and gender advocate with over 15 years of experience working in post-conflict and emergency contexts across East and Southern Africa. Her career spans international NGOs, government agencies, and multilateral and bilateral donors, where she has consistently driven impactful health system strengthening and financing reforms. She brings a wealth of expertise in program design, strategic implementation, and public financing management. As the National Accounts Country Lead, Ms. Elisama plays a vital role in enhancing the flow of financial information from national and subnational levels, improving transparency and efficiency in health spending. A passionate advocate for gender equity, she co-authored the gender analysis chapter in the European Union's funded forward-looking analysis of the health sector in South Sudan, identifying critical gender challenges in conflict-affected settings. Her work under the UK's Conflict Security and Stability Fund include award-winning proposals addressing governance and coordination in fragile health systems. She is also a published co-author on leadership, governance, and health financing in humanitarian development settings. Ms. Elisama holds an MBA from the University of Northampton, a postgraduate diploma from Liverpool School of Tropical Medicine, and professional certificate in health economics from Swiss Canal University, and health system strengthening from the University of Melbourne. With her rich interdisciplinary background and proven leadership, Ms. Elisama is a powerful voice in shaping resilient, equitable, and accountable health system in fragile contexts. Our third speaker panelist for today is Dr. Margaret Betty Eyobo. who is a prominent public health expert and medical professional with extensive experience enhancing health outcomes in South Sudan. She has previously served as the Monitoring and Evaluation Officer for a USAID-funded SIAPS project, where she played a crucial role in advancing healthcare initiatives and strengthening health systems nationwide. Additionally, she worked with Chemonics, contributing her skills to various health programs that aim to improve community well-being. Currently, Dr. Yobo serves as the Deputy Chairperson of the South Sudan Immunization Technical Advisory Group SITAC, where she influences immunization strategies and policies to promote public health. Her educational background includes a Bachelor of Medicine Surgery from the University of Barre Ghazal, a postgraduate diploma in malaria program planning and management, and a master's degree in public health from Hebrews University. Dr. Eyobo's qualification and experience make her a vital asset in the field of public health in South Sudan. Last but not least, we have the fourth panelist, who is Honorable Professor Dr. Peter Adok Otto, who is a distinguished respiratory physician, medical educator, and a parliamentarian with over 3 decades of experience in clinical medicine, public health leadership, and medical education across Sudan and South Sudan. He currently serves as the Member of Parliament in South Sudan's reconstituted Transitional National Legislative Assembly, where he sits on the Health Committee, contributing to national policy dialogue on health system strengthening and health financing. He is also a member of the South Sudan General Medical Council and the South Sudan Research Council, institutions that are central to upholding professional medical standards and promoting scientific inquiry in the country. Dr. Otto earned his medical degree from Zagazig University in Egypt in 1985 and subsequently specialized in respiratory medicine through the South Sudan Medical Specialization Board, Medical Specialization Board, from which he graduated with distinctions. His career includes years of clinical service in Upper Nile, coordination of tuberculosis control programs, and over 2 decades of academic work at the University of Upper Nile, where he serves as the assistant professor of respiratory medicine. Between 2003 and 2005, he served as the Minister of Health in the Coordinating Council in South Sudan, based in Khartoum. In that capacity, he represented the Council internationally, including in Washington, D.C., and launched initiatives such as the Juba HIV/AIDS Initiative with WHO support, demonstrating his enduring commitment to health, equity, and public health diplomacy. Dr. Otto is also a published scholar and historian with a strong interest in cultural preservation and knowledge production. His deep grounding in medicine governance and community engagement positions him as a leading voice in efforts to reform and revitalize South Sudan health system. So welcome to all of you. I don't know if you feel like you want to turn on your videos to interact with the audience. I would appreciate that. So we'll go with to question. Yeah, thank you so much. We'll go to start with the question that have been sent previously, and then later on we'll, after finishing this list, we'll take some questions from the audience. I want to start with Laura. When we talk about financing, health financing, what are we actually referring to? Can you, especially if we talk about financing for immunization, what does it entail? Can you break it down for the audience, just so that all of us are on the same page as we go along? Thank you. I hope you can hear me.
Yes.
Oh, awesome. All right. Um, Laura Elisama, can you hear me? Okay. I will come back to Laura. I, I, Professor, can you hear me? Let me confirm if you hear me. I'll go to you next. Can you hear me, Professor? Yes. Professor, yes, thank you. Thank you that you are hearing me. Could you, just to set the stage and sort of, yes, yes, I can hear you, but you're breaking. If you could set the stage on sort of like the current state of things in terms of,
can hear you.
okay, great, great. Could you talk a bit about the health committee's current priorities when it comes to health sector financing? And specifically, when we talk on immunization, what are the current priorities of the committee in terms of health sector financing within the national budget? Is there anything you're working on? What are those priorities that aligns with, say, immunization from the committee's perspective?
Thank you for this introduction, Mr. Kamish, and welcome to our friends on this panel. I went into the parliament in 2001, and the biggest challenge was always the budgeting. The first time I was in the parliament, the budget of health sector as a whole went to 9, and we were very pleased that might be in the following years we shall approach the Abuja um, allocation for health in Africa. Unfortunately, the second year, the budget dropped to 7, and last year it dropped to 2.4. So you can see now how things are getting tougher and tougher. And allocation is usually made for the health sector, the Minister of Health, South Sudan General Medical Council, HIV/AIDS Commission, Drug and Food Authority, and the Institute for Public Health.
Mm.
But the vaccines as such are usually seen as part of Mother Minister of Health. Unfortunately, there is a conception in this country that the health is being helped by international community, and by so doing, we have placed our health in the hands of unknown, at the whims of unknown. Many people think health is not an important aspect. They think they're spending a lot in health. When we say health is an investment, you invest in health for the future people. So you can look at the budget of 2.4 or 2.3 in the annual budget, and they bring it as a ceiling, and the parliament usually adds nothing. They tell us to stick to the ceiling. And when this money, if this money came every time in full, would be better. But it does not come as usual. So to talk about vaccination as such, it is very difficult for me in this particular talk or conversation to assure you that we are able to allocate a portion of this meager budget for vaccination. After all, there was an attempt that we do, is very common among our youth, and there was nowhere to get the budget. Most of the people think that health is somebody's health responsibility. They don't think it is their own. So we are always fighting in the parliament, either to increase the budget or leave it as it is, or give priorities to the areas we want, but nobody listens. So hello, hello, do you
Uh,
hear
Continue. Go ahead. Yes. Professor, we are able to hear you. Please go ahead.
Kemish? Yeah, future, whether we'll be able
Professor, will come back to you. Looks like your
to
internet.
vaccinate after, especially after Trump's support for U.S. Whether it's not proper? Okay. Okay, go ahead.
Dr. Kemish, you're muted.
Okay, great. We'll come back to you, Professor, because that is very critical to talk about what are some of the priorities at the committee's level and some of the challenges that you foresee moving forward. And you hinted a bit on where the landscape of financing now is tricky with what is going on, and you clearly said it as well. Dependence on donor funding. I want to go back to Elisama. If you can hear me now, can you?
I
Yeah.
can.
Awesome. Thank you. Thank you, Elisama. I had a question for you at the beginning. Um, if you could, we have audience here who may not quite understand when we talk about financing. Thank you. I can see you. Financing for health, and specifically if we talk about financing for immunization, what does that mean? If you could break it down, and then I have a follow-up question after that based on what Professor Peter said. But I want to give you the time to provide for us that technical breakdown of what that means, financing for health or financing for immunization.
Thank you. So health financing in immunization entails mechanisms by which immunization programs are funded and resources are allocated to ensure access to vaccines and related services. It talks about all of this, but again, when we talk about funding or resources, we need to look at how all of this is done. So one, it's from the government, so government budgets. Then we have the external aid that Professor Advocacy just mentioned. And we also then have the health insurance. And then we talk about other resources as well, could be resources that are pooled. A perfect example could be the example that that we had when we had the Health Pool Fund project or program that had various donors that had pulled in funds together, and to be able to facilitate or implement immunization projects across the country. So maybe I can then have your follow-on question.
Thank you, for breaking that down in terms of looking at the streams of financing either coming from government, from the donors, and the private setting. Professor Duke just mentioned how small the national budget that goes to health, and I think he mentioned he has been decreasing, and last one standing at around 2.4%, which is clearly mentioned. This is way below the 15% that African countries has pledged according to the Abuja Declaration. What do you think are the challenges with this sort of funding, and if financing of immunization is sufficient in the country? what sort of challenges would this pose for public health interventions?
Okay, so that basically, the gap creates overdependence on donors, which ultimately then creates vulnerability. Because one, health, it's not a pathway to health independence. So it weakens also, overdependence on donors for funding weakens the country's ability to negotiate for better terms for the aid it receives. Apart from just, the fact that it's not a pathway to health independence. So at the end of the day, I think we are all at the mercy of donors. And at this stage in time where things are quite volatile, let's say from the Trump administration, the new administration that just came in, we've seen shocks and stresses that came in with the new administration, the funding cuts. So I think it's crucial for us as a country to be able to develop strategies that can reduce reliance on volatile and unpredictable donor funding to minimize the chances of backsliding after such shocks and stresses. But I also think, as we move forward, what would it be like for us to be able to build resilience and sustain progress? One is to reclaim, health independence. And how do we do that? We can do that by first making it a priority and making it a national security, and taking greater ownership of our own health initiatives to protect the health of future generations, build resilience, and also ensure sustainability. And for these to be achieved, there's great need for us to evaluate our preparedness for transition. One would be, the financial stability, health infrastructure, and also governance. This requires strategic planning, such as strengthening domestic resource mobilization, improving governance, and also fostering new partnership. And just not new partnership per se, but also maintaining the partnerships that we've had in the past, and also forging new ones. Thank you.
Thank you. Thank you. I just want to continue from what you've just said, which is fostering partnership. And I want to bring in Anika from Gavi. Anika, could you, from Gavi's perspective and considering sort of the movement to the new strategic plan 2026, 2030 that Gavi is moving to, what are some of the key factors that influences Gavi's sort of selection of countries like South Sudan? And especially when you look at sustainability, moving beyond the today to the tomorrows of vaccine financing from Gavi's side.
Yeah, sure. Thank you. So, I mean, from Gavi's perspective, funding decisions for countries like South Sudan reflect a careful balance of several factors. In terms of selection of countries, this is a very easy policy that we have. It's our eligibility criteria, and this is based off of a country's GNI per capita. This is released by the World Bank every year. And within Gavi, we have thresholds that we have to understand whether a country, like where a country falls in terms of Gavi's eligibility, all the way from initial self-financing, which is countries with the lower GNI, so the low-income countries per World Bank threshold, all the way to when a country is Gavi fully self-financing, you can say, or transitions completely out of Gavi's support. And these countries are expected to fully finance the vaccines on their own. And in between this range, a country is basically expected to pay for vaccines at a different amount, slowly increasing towards basically fully financing their vaccines. When it comes to new vaccines or introduction of vaccines, one of the biggest factors that's important is to ensure that when a vaccine is introduced, it does not become unsustainable, especially once donor funding phases out, right? And of course, Gavi's mission is to improve access to vaccines, specifically the new and underused vaccines, prioritizing those that deliver the strongest health benefits. So, basically, we do consider things like disease burden, cost effectiveness, and impact of vaccines as the individual countries also make those decisions. And in the case of the PCV and Rotavirus, for example, these are very critical vaccines, as pneumonia and diarrhea remain a leading cause of child mortality in South Sudan. But there are also other aspects that are incredibly important, right? I'm not going to repeat too much of what Dr. Elisma mentioned, but ensuring health systems and financial sustainability are very critical factors, because whether it's new vaccines or ensuring vaccine programs, robust cold chain systems, trained healthcare workers, reliable data systems. These are all really, really important in making sure that we don't overburden already fragile systems. And Gavi does provide additional support through specific grants, all the way from cold chain or supply chain improvements, community engagement, and gender equity initiatives, for example. Being someone from health financing, what my team does and what is also placed significantly within Gavi's policies on the aspect of financial sustainability. So we use indicators such as, to assess fiscal space, general government health expenditure, GNI, as I mentioned. And this is really directly because countries are expected to contribute, even in the initial self-financing stage, as South Sudan is in, to a percentage of or amount of the total vaccine costs, and be able to slowly and gradually increase the amount that they are contributing to as their fiscal capacity grows. And so sustaining new vaccines is going to be really heavily dependent on South Sudan's fiscal space and long-term planning.
Yeah, yeah. And I don't know whether South Sudan still is at that stage of $0.2 per dose contribution co-financing. How do you, given the two new vaccines that have been introduced 2-3 months ago, how do you assess South Sudan in that sphere of sustainability? Do you feel like the conditions South Sudan meets the conditions to continue that engagement? And with Gavi, does this condition differ moving forward? Do you think like the condition will differ moving forward from 2026, given sort of like the new policy? Like, where do you assess South Sudan lying within some of those conditions you mentioned?
No, based on the current GNI, and as I mentioned, the eligibility is very, very straightforward for Gavi. There's not a lot of complex indicators and discussions. It's very simplified and easy using the GNI. And so currently, per the GNI for South Sudan, the country still falls in the initial self-financing stage. So this is the first tier. And as you mentioned, it's currently $0.2 per dose. This is really, the grander scheme of the transition process, a lowest amount of co-financing for a country to bear, right? However, I think the co-financing is still really important, despite the fiscal constraints a country might have or the fragility context, because this is really increases the national ownership of vaccine programs. So in addition to that, though, just for context, Gavi does also apply flexibility policies for fragile states. So South Sudan does qualify as a fragile state. The policy allows us to recognize complexities countries face, dealing with chronic fragility, acute emergencies, large displaced populations. So there are a few different criteria here. And this will allow us to basically tailor certain support in terms of co-financing as well. But in general, despite the flexibility, there still does remain an expectation for progressive steps a country takes to ensure national ownership. This will include, for example, ensuring budgeting, financial tracking, and strategic planning to be able to gradually shoulder cross over time.
Thank you. Thank you. Dr. Betty, I'll come to you in a bit, but I want to go back to Elsama. If you could, given the reality, and you talked about sort of the different modalities of financing, being from government, from donor funding and private sector, and the low budget that goes to health at the moment from the national budget. What are some of the implications that you think South Sudan will have due to that over dependence on sort of the donor funding mechanism more than the other mechanisms of financing immunization?
I think the major challenge will definitely be a backslide. That all the gains that we have achieved over the past few years will be undone. Because one, again, over-reliance on donor funding. I think I made a mention of Donald Trump's new administration and what came with that, the funding cuts. And that we have to ask ourselves, were we prepared? We were not prepared. Do we have some sort of funds that can be used for such shocks and stresses? Because that was a complete shock that came in for other countries. But for us, I think we had something in the pipeline, thanks to some of the donors that have been able to support us. But I think we are heading towards a transition period that is imminent. The reason why I see this is because once the funding starts dwindling down, what is our capacity to absorb the shocks? So we really need to think about how can we mobilize resources internally and maybe diversify also our funding sources so that we can be able to sustain the health system. Otherwise, it will be catastrophic. It will be terrible. Over to you.
Thank you. Yeah. Thank you for that. I think we want to go into sort of decision making and risk management, and I want to bring from sustainability, looking at how we could sustain sort of the introduction of the 2 vaccines moving forward. Dr. Betty, as you sit in the body that makes the decisions on CTAC, that makes a decision on whether or not to introduce vaccines. And that was crucial in the introduction of the 2 vaccines that have recently been introduced. Sort of, I want you to speak about how the body factors in sort of that long-term sustainability of newer vaccines and affordability as well. Before you decide to introduce a vaccine, what are some of those factors that goes into whether or not certain vaccines will be sustainable or will be affordable in the long run?
Thank you. I hope you are getting me.
Yes.
Yeah.
You're clear.
Okay. So before I try to answer your question, maybe let me just give you guys a brief on what the CTAC's responsibilities are. So generally, the role of NITACs is to provide evidence-based recommendations to policymakers on vaccines and vaccine-related issues. So here, the NITAC actually has it has the powers to recommend, like when the ministry proposes the addition of a vaccine, they bring it to us, then we review the evidence and say, okay, go ahead, you can add it into the immunization schedule. But also it has the powers to propose that, hey guys, maybe we need to add vaccine X into the immunization schedule. And in that situation, the NITAC has to provide the evidence of why they are proposing that. So, and the third role they can do is actually to review an existing vaccine, which is already in the schedule. Like if there are improvements in that vaccine or it's needs to be changed or something like that, they have the right to review it before passing that recommendation. Now, coming to the question that you're asking about long-term affordability and sustainability, actually, I think this question is more of policy rather than a consideration that should be factored in the CTAC when making recommendations for the addition of a new vaccine. And why am I saying that? Because in South Sudan, actually, it's a policy. Health services, including vaccines and vaccination services, are provided free of charge. So this literally means that from the community, or rather the client perspective, they don't have to worry about affordability or sustainability. But then from a policy perspective, the question probably is, how are vaccines and vaccination services being funded, and can this funding be maintained? That's probably the question. Now, as part of the South Sudan is actually part of the low and middle income countries, as has already been cited by my colleague from Gavi. And because of that, most of the vaccines we have in the country are actually funded by Gavi, in addition to other partners who fund it, like UNICEF and WHO, and also the government is putting in some funds. However, you're already aware, and the lady from Gavi has just cited that Gavi has already introduced a co-financing policy, whereby countries are expected to transition from Gavi support to self-reliance. So it's something that's going to happen, like whether we postpone it for years or I don't know how long, but at the end of the day, it's like something somewhere is going to happen. And not only that, we are also fully aware of the changes in the donor funding, like what's happening, the transitions and everything that's happening in the country. It's quite obvious. Like the future is not very clear when it comes to donor funding. And this makes the question of affordability and sustainability really important. However, because right now it's not like directly our worry as NITAC, because most of the vaccines are actually proposed by the government, and during the process, the evidence-based recommendation process, we actually do review whether these vaccines are already funded, whether they are funded and how is the implementation going to take place, all that kind of thing. So what we usually do is kind of a cost effectiveness analysis, like what's existing there now that you want to introduce this new vaccine. And that same evidence recommendation process was done for PCV and Rotavirus vaccines, and that's why they were recommended. Thank you.
Thank you, and thank you for giving that background, which I think is very important to understand sort of where we are coming from. Like who recommends new vaccines and how did we end up with the PCV and the rotavirus? You clearly mentioned, yes, the policy role or the policy advisory role of the CTAC would be to sort of recommend, but then the long-term sustainability question is more broader. So I wanted you, if you could, from your role as well as the CTAC, what are some of the critical, given the introduction that we have introduced PCV and rotavirus vaccine, what are some of the risks that you foresee in terms of sustainability of these two vaccines, if any, and if what could be some of the active measures that the country could take? You rightly mentioned at one point or another, this co-financing would have to decrease, and a lot of the weight of financing of vaccines would have to be taken up by the other measures, which is really by the government. So what do you see some of the risks moving forward, and what are some of the measures that, as a country, we could start pedaling towards, as that time comes?
I think the biggest risk that's quite obvious is actually the financing problem. Given the what I've mentioned earlier, that the current uncertainties around donor funding, and also the fact that we already have a co-financing policy introduced by Gavi. So it's so the issue of funding is actually very critical to long-term sustainability of vaccines. And this includes the rotavirus vaccine and the pneumococcal conjugate vaccine, because these vaccines are going to be there like forever, you know. We don't know if we're going to end it soon or whatever, but so it's going to be there for a long time. And so this financing thing is cross-cutting, and I personally think it's the most important, because as long as we can be able to purchase the vaccines, we can be able to maintain immunization and the immunization services in the country, which are critical. Now, given that funding is important, then what needs to happen is that we need to secure alternative funding sources. We need money at the end of the day, and we need to look for an alternative source of money. And the most reliable that we can think of as an ITAC is actually the government. Because governments are there forever. Like once you secure the funding from them, you know that you are covered. And that's probably why Gavi is pushing for governments to prioritize immunization and vaccines funding. Now, maybe what we can do to secure this government funding is that it has already been mentioned by my colleagues here, immunization should be made a health priority. And this should happen during fiscal year planning and budget allocation sessions. Like it shouldn't be something that's just proposed like there and then during the budget discussion, but it should be there during the planning phase for those budgets. When the budgets are being allocated, they should think of immunization, and it should also be factored in long-term national plans. And my personal idea, it should be stand-alone, independent. It shouldn't be put under those health budgets like the 2.4% mentioned by Professor Peter Adok, because anything can disappear under the 2%. We need to sit standing there alone very clearly. This budget is allocated for vaccines. That way, we can ensure that when the time comes to buy the vaccines, we have the money. We know where the money is. We can walk there confidently, not us actually, but the EPI program and the Ministry of Health. They can walk there confidently and request, hey guys, we need to buy this, give us the money. And if there are any accountability mechanisms that have to happen, then the program has to account for that money directly. That makes things a lot easier than going through complicated procedures, and then you end up with vaccine stockouts and a lot of complications, and that's not acceptable. However, this doesn't stop us. Like once we're engaging with the government, it shouldn't stop us from lobbying for support from partners, as long as it's still there. Like Gavi is still supporting, so we can still continue to lobby for Gavi support through the program. However, it's important that we diversify the funding sources. Like we can also look for other donors. Maybe there's somebody out there who is willing to throw in some money into vaccines. It's not a bad idea to look into that. And maybe we can also explore some public-private partnerships. It's unfortunate, I don't know of any big companies in this country, but if there were, like you can approach a company, hey guys, why don't you help us to fund X number of vaccine, you know, that kind of thing. So these are things that can be explored. Like we need to widen our horizon and look for other sources of funding. And I think another thing that needs to happen, it is already happening, but maybe we need to like look into it further, is this issue of collaboration and coordination among partners. It has been mentioned by one of the panelists here, but that's something I want to stress on. And one thing we can look at is cross-ministry collaboration. Like who can fund this for us? Like who has a redundant budget somewhere, you know, stakeholder engagement, do some donor coordination, like can we maneuver this money, move it this way or move it there? Like, you know, can we do something? And not only that, we can also integrate activities. Yes, within the EPI program, there is already integration of activities, like somebody is going out for some outreach, then you can also send the EPI vaccinators along with them and they can work together. Like the transport will be the same, so that cuts down on costs of transport. You know, there are some things there that can be merged, like integrated, and activities can flow together. And last but not the least is the issue of strategic investments. I know we've always been talking of investing in systems, because vaccines are actually cross-cutting. Like if the health system itself is strong, there should be no problem with the implementation of vaccination services, because you'll be using the same stuff. I mean, you're not going to be hires, bring stuff from another facility, but the same stuff in the facility, you'll be using them for the vaccination services, and that cuts down on costs. And not only that, you can also, like once you add these vaccines into these multi-year plans, then the resource allocation becomes automatic. And that's why I initially said that government is the most stable source of funding. Like once it's there, and Professor John Adwo can correct me, once the budget has been allocated, then definitely every year you're going to have something flowing in there, and that's actually kind of like most reliable. And also people need to invest in data, because like you need to have evidence. Like when you vaccinate the children and you need to request for budget, like you need to increase budgets, at least you should have evidence that, hey guys, we actually bought this quantity of vaccines, but you can see here that we only vaccinated this number of children and we have like this big, like a gap here. So maybe you guys need to increase our funding for us. So investing in data is also important. So all these strategic investments need to be strengthened so that things can flow more smoothly. Thank you.
Thank you, Dr. Betty. And it's helpful to hear those different pieces from really strengthening the health system that would spill over to immunization as well. Yeah, and I think I wanted to pause. I think Professor Adwo has dropped or is around. Can you confirm, Emily, if he's around? No. Okay. You did talk about data, use of data. I'm wondering, I wanted to go to Sama from an economist point of view. Do you see specific analysis that partners or civil society could take to sort of advocate for this increment in budget allocation that we are talking about, specifically targeting immunization as we move toward reducing that co-financing and maybe the government taking over a bigger chunk of financing immunization in the country?
Yes, actually, before I get to answer this question, I would like to go back just a little bit longer to where Dr. Betty started off from. And I think I wanted to touch on, the long-term consequences of the insufficient, ambiguous domestic funding allocations and operational cost of vaccines or vaccination campaigns and routine vaccinations, or vaccines rather. I wanted to say that, the long-term consequences on public health is the reduction in vaccination coverage. And this is due to the limited resources, that is available. And so that hinders or reduces the coverage. The other bit is also the increased disease outbreaks due to disruption of immunization services. And I think this goes back to the shocks and stresses that I mentioned earlier. And all of this, which ultimately then leads to outbreaks of preventable diseases like the cholera, measles, and other vaccines preventable illnesses. Erosion of also public trust. There will be a decreased demand for immunization. Once there's a disruption there, obviously, then we have more roles to play in coaxing or getting the community to be able to come in and, accept vaccines again. The other thing is also the higher morbidity and mortality. And this is because of the increased case of vaccine preventable diseases, especially among children. And then, of course, we have the economic impact. So that's the outbreak of increased healthcare cost and strains that are already, because we're already a fragile community or a fragile economy. So basically all of this system. and backsliding to undo all the gains that we've achieved. The other way to deal with this or to address this funding gaps or financing gaps is to improve community engagement. And we can do that by community participation and health awareness campaigns, which are vital to increase vaccines acceptance and uptake. The other part is also diversifying funding sources by increasing government's investments in immunization and diversifying sources just beyond the
Blocking with too many advertising and little memory space. Solve this right now. Download this revolutionary.
Professor Adwo, can you mute? Oh, thank you. Go ahead, Elisama. Sorry for that.
Right. So the other bit is also strategic planning and coordination, developing and implementing a comprehensive national immunization plan with clear goals and strategies. So we need to, at the end of every year, annually, we can evaluate our performance based on the targets that we've set for ourselves as a nation. Now to the question that you've asked. There will definitely be, my number one would be the return on investments analysis. This is crucial because one, it calculates the ratio of benefits to cost. And also it's often expressed as a percentage or a ratio. And it quantifies the financial returns. And if you look at it, a higher return on investment indicates a greater return on investments, demonstrating that the benefits outweighs the cost. And so that also then provides a clear metric of decision making that can be easily understood by decision makers and then can justify increased investments in immunization. The other one is the cost effectiveness analysis. And this compares the cost of vaccination programs and the health benefits, which is basically in most terms measured in terms of quality adjusted life years or disability adjusted life years. This also informs resource allocations by prioritizing investments based on best health outcomes per unit of cost. The other one I would mention would be the cost benefits analysis. This expresses all outcomes in monetary terms by basically, the value of all cost and benefits of vaccination programs, which includes averted health outcomes, cost, productivity gains, and even the value of statistical life. And of course, then we have another fiscal health modeling and advocacy and communication. So thank you. Sorry, let me just maybe summarize this. But I think if we use all these models, health economic analysis can provide compelling evidence that immunization is not just a health intervention, but also a valuable economic investment, justifying increased domestic investment and demonstrating a strong return on that investment. I think that is crucial as we go out and as we advocate. This needs to really, really come out very, very clearly that that it's just not health intervention, but also a valuable economic investment. So thank you. Over to you.
Thank you. I like that last piece that summarizes it very well. That we do all these studies and make the case that immunization is not just a health intervention. It is an investment, a social investment that has the value to improve a country's quality of life, and eventually, I think greater than that. I don't want to talk about, but thank you for that piece towards the end. Professor Duok, you're welcome back. I wanted to pose a question to you if you can hear me.
Yeah.
Yes, thank you. At the parliament, the legislative arm of the government, what are some of the things that you are currently doing? We have noted, as you rightly mentioned, sort of the very low allocation of the national budget that goes to health, and less so to immunization, if any. what are some of the things that you're taking, the steps that you're taking now to one, increase that, financing or budgeting that goes to health, but also particularly to immunization? If you could speak a bit about that, even more now that we are seeing that the donor arm of the mechanism of financing is reducing, or it has already reduced and may further reduce with time. So if you could break that down for us, that would be very, very helpful on some of the priorities that you are working on in the House.
Thank you very much. We in the House, we usually deal with a budget that comes from the executive branch, and usually it comes with a ceiling. And I told you to break that ceiling is not possible usually. But I want you, if you can share this slide with you, because we have to solve the problem from the root. Can you see this?
No, if you're sharing any slide, we cannot see it. Unless you don't have the rights to share, maybe Dr. Emily could give you.
I have two slides about a true health system and a very fragile health system. If the government in any country does not realize that health of the people is a priority, then there's no way we can talk about investment. I have just quoted in the first place that until everybody in a country believes that health is an investment, then they will see it as secondary, like they put the health of the people in this country in the hands of NGOs. So that's why I wanted to show these figures. If two models of health system and vaccination being part of it. Of course, there are people who are those who are afraid of vaccines and so on. But we have seen from the COVID-19 that science has developed, and it is easy to develop vaccines in a short time. And the old vaccines take years to develop. But this mindset of that the vaccine made in months can help people was very difficult to inject into the minds of other people. In the parliament, I agree with the last speaker that we have to devise ways to resource mobilizations so that we are able to save our kids by vaccination. I completely believe in vaccination, and I made a remark one time that I'm happy that vaccination against malaria came in my lifetime. Some people do not realize this important thing. So any system that is not led by the government, in health system that is not driven by the government, it is a failed health system. The best health system we know is in Taiwan, and the best others in Scandinavian countries, where we call it universal, because everybody in a country has the right to get treated by the government, or might be co-funded treatment. You pay and the government pays the rest. But if the government is paying 2.4, we don't know. Now we are waiting for the budget. I'm afraid there will come a time when the budget is zero, and then they say, okay, you go and look for out of your pocket. And this is going to be a disaster. And the people who are in the field, if they decided to build resilience and perseverance, to put together their efforts to find ways how we can purchase vaccines or pay for the vaccines, that would be better. With the Trump new order in place, USAID was paying a lot of things like RV drugs and the HIV testing and everything. That made it better for people. Now, people are predicting in coming years, the death from HIV AIDS is going to increase because the funding has been cut. However, we the Africans, it is time to think about ourselves instead looking for America to give us money. This country is a very rich country. If people invest really in health, they can afford maybe 90% of the vaccines. But the elites or those who are not concerned with the health do not see that point. I come back to you.
Thank you, Professor. And I wanted to push you a bit on what you said. As you said clearly that some of these are determined from the other arm of the government, and some sort of ceiling that comes with it. So, what sort of collaboration, or what do you think could enhance this relationship between the legislative arm and the executive arm of the government to sort of see the priorities of investing in immunization, for example, not just as a health intervention, as one of the uh, speakers said,
Pardon
but
your,
also as
I'm
a
not hearing.
as an opportunity for growth of the country. Yes. Did you hear the question, Professor Doc?
Again, repeat the question.
Yes, I wanted to push you a bit. If how could we enhance that collaboration between the legislative arm and the executive arm, based on what you say, that sort of like the ceiling that comes from the executive arm, right, on some of this budget that goes into health. How could we improve that relationship to see the priorities and the importance of investing in immunization, not just as a health intervention, but also that it is an investment in human capital, is going to foster growth, and economic development in the country. What are your thoughts?
Thank you for that beautiful question. The question is the budgeting process. The budgeting must start from down and upwards. What happens in this country, that budget is made and brought from top to the bottom. And when it comes to the parliament, they say this is a ceiling which you should not go above, because the budget is the requirement of institutions. This institution needs this, for that, for that. But if you are given 2.4% of health budget, how am I going to divide this? If I give the Ministry of Health proper a piece, I expect this piece to contain what we should use for vaccination, because vaccination part and parcel of the ministry, the mother ministry. I will allocate some for HIV/AIDS Commission. I will allocate for South Sudan Medical Council. I will allocate for Food Drug Authority, and I will allocate for the Public Health Institute, which we have just passed the parliament recently. But unless the budget is raised, there is no way you can, there's no way I could have shown you between a failed or a fragile and a strong health system. This must be clearly, very, 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 must be shown out that the problem is health system. Thank you.
Thank you. Yeah. Thank you, Professor, for sharing what is happening in the House as far as the budget that goes into health. I want to bring back our economist, Elsama, given the realities now, and where we are, and also like the cuts that we are seeing from the donor arm. What are some of the innovative sort of ways that South Sudan could tap into beyond the traditional mechanisms of funding that you can think of?
Thank you. Maybe if I can perhaps maybe add on to what Professor Adwok had just shared. Other mechanisms that we can use to lobby or advocate is to translate complex data into very easy to understand material. Health economics analysis can be used to create these compelling narratives and visuals that can communicate the value of the vaccinations to policymakers, to the public, and also to other stakeholders. And this is all by providing evidence of the economic benefits of immunization. And I believe that that can strengthen advocacy efforts aimed at increasing domestic investment, because I think our target right now is the domestic investment. How can we, get to policymakers and also budget holders, or just to advocate? And if we can translate all this complex data, I think we might be able to win few individuals that might be able to also be voices within the parliament to lobby for an additional increment into the budget. You've asked about, sorry, what was the question? What was the question?
Yeah. Given the realities now with the low allocations that in the national budget, and also the donor arm, which is reducing, what are some of the innovative ways that we could potentially tap into as a country that could bolster sort of like the immunization financing in that, like outside of the traditional mechanisms? Yeah.
Okay, thank you. So I think the first one is definitely public-private partnerships. We need to look at, the opportunities with health insurances. If we partner with a health insurance provider to offer subsidized or income-based health insurance packages that include vaccination services, I think that would be great. And also service delivery where private healthcare providers to deliver vaccination services, particularly in underserved and hard-to-reach areas. And when we talk about hard-to-reach areas and underserved, these are basically, moving also with communities that are always mobile. And during floods and droughts, also having, services delivered to communities that are completely cut off and in hard-to-reach areas. The other one is pharmaceutical manufacturing as well. If we can collaborate with private companies to establish a local vaccine production facilities, that would definitely reduce reliance on imports, and that would also ultimately also create jobs. We can also look at community-based financing. Maybe we can empower communities to contribute in kind to vaccination campaigns. I think there's an awful lot when it comes to vaccination, rolling out campaigns, and etc. But also one way of drawing in the community and having the community sense of ownership is having the community participate, and having them participate by contributing in kind in terms of labor. Sometimes also carrying the vaccines, or supporting, and etc. Just that really does make a huge difference, and also the impact is great. We could also maybe perhaps look at microfinancing initiatives. If we develop like a microfinance initiatives, like the schemes that could provide small loans to individuals for accessing vaccination services. All of these are things that we could start doing, and also social impact bonds, where we attract private investments, where we can also secure upfront funding from private investors for specific vaccination programs, with government agreeing to pay the investors based on the achieved health outcomes. So this is more like the performance-based financing, where you set a target and you have someone work, and then based on what they've achieved, then you can pay them. But now this is basically, this could be, we could take this as a coverage, vaccination coverage rates, or outcomes based on also funding, which we could design programs to achieve measurable results with payments contingent on the achieving these results. I think if we combine all these, innovative funding mechanisms, with improved domestic resource mobilization and strengthening or strengthen existing systems, I think South Sudan can create a more sustainable and resilient approach to financing its vaccine programs, and hence also reducing its reliance on external aid in the long run.
Yeah.
Thank you.
Yeah, I sort of like bringing those different, even though, different perspective, they add up, and I think especially private-public sort of collaboration will be very important. And why not venturing into vaccine manufacturing in country? That would be a very good initiative, right? And sort of like that community based financing and microfinancing. Yeah, looks like there are avenues to tap into. Thank you so much, Elisama, for sharing that. I want to go back to SITAC, Dr. Betty. I think at the group, are there ways that you could, given what we have heard from Professor, what is happening in the house, and also from Elisama, what we could do? Are there ways that we probably, I think, at the capacity of the SITAC group, that these collaborations with, say, the ministries concerned with allocation, say, Ministry of Finance and Planning, are there ways we could intentionally and very clearly sort of get some financial commitments for immunization moving forward? And do you see a way there, and how the group could influence sort of these different ministries to support this advocacy that we are talking about, that will then enhance, sort of like increase eventually what goes into the health budget and eventually into immunization?
Thanks for the question. Actually, when it comes to collaborating with the Ministry of Finance, from my point of view, it's not actually a collaboration, because working with the Ministry of Finance and Economic Planning is actually by default. The Ministry of Finance and Economic Planning is part and parcel of the NITAC, because the NITAC has only 2 ministries that it's working with, other than the independent core members that they're like the voting groups. The 2 ministries are the Ministry of Health and Ministry of Finance. So Ministry of Finance and Economic Planning is actually part and parcel of the NITAC. And how is that? I'll give you a brief on the structure of the NITAC, the organogram. So I'll be talking, no slides. Now, when you look at the SITAC structure, other than the SITAC, sometimes it's SITAC, South Sudan Immunization Technical Advisory Committee.
I feel bad for, I hope I'm not.
Can you mute? Thank you so much. Yeah, sorry, Betty.
Yeah, which is actually the National Immunization Technical Advisory Committee, NITAC. So I'll be alternating between NITAC and SITAC. So when you look at that structure, actually, other than the secretariat, it composes of the core members and the non-core members. The core members are 11 in number, and these are people from different health specialities. And out of these 11 members, actually 2 of them are from the Ministry of Finance and Economic Planning, a health economist and a health systems expert. Now, when you look at the non-core members, there are 2 types of non-core members. We have the liaison members and the ex-officio members. The ex-officio members are from government institutions, namely the Ministry of Finance and Economic Planning and the Ministry of Health. And these members are 5. And these include the DG for Primary Health Care Services at the Ministry of Health, the DG for Preventive Health Services at the Ministry of Health, the Director for EPI Services and Child Health at the Ministry of Health, the DG, Director General for Finance from the Ministry of Finance, and the Director General for Economic Planning at the Ministry of Finance and Economic Planning. So there's two of these Director Generals are supposed to be attending the NITAC meetings because they are members. Now, the liaison members are from partners and other institutions within the country, namely the World Health Organization, UNICEF, the Drug and Food Control Authority, the Association of Public Health Logisticians, and the South Sudan Red Cross. At least within the current team, which has a tenure of 4 years, those are the members that are supposed to be in the liaison team, and they are supposed to be attending all the NITAC members. So looking at that, the Minister of Finance is part and parcel of the NITAC. So the question that should have been asked is, what is the NITAC doing to ensure a clear financial commitment backs vaccination introduction decision? Unfortunately, my colleagues from the Ministry of Finance and Economic Planning are not here because they are supposed to answer that question. They are the direct link. And that brings me to the challenge of the CITAC. One of the key challenge we're facing is that is the limited engagement of the members, among which we have the Ministry of Finance and Economic Planning. Like I mentioned earlier, the tenure of the CITAC is actually 4 years, and this current one was set up in 2023, January. So literally, it's like we are 4 years, 2.5 years in office already. Okay. Now, in these 2.5 years, me being the deputy chair, I've never seen anyone from the Ministry of Finance and Economic Planning attending any single meeting. That alone speaks a lot. However, we have not given up. We have actually been following up on this issue through the Ministry of Health and the EPI program, like talk to them, see what's happening there, but have not been successful to date. But we are still continuing with that engagement, and hopefully if we don't succeed during our tenure, the upcoming team might succeed to get their involvement. Thank you.
Thank you, Dr. Betty. Appreciate. We are almost winding up, and I have 2 more questions for Ms. Anika. From Gavi's, how can South Sudan position itself to be able to continue receiving this support, to support the budgetary deficit, but at the same time is building its capacity to increase that co-financing and eventually, take over. So what are some of the things that you feel the country should be able to do to be able to position itself very strategically to be able to receive those supports externally?
Yeah, no, thank you for the question. I think it's really important in this current climate, especially, right? So I think, one, it's very important for South Sudan to continue to demonstrate strong political commitments to immunization. So even in challenging contexts, keeping immunization high on the national agenda really demonstrates prioritization of health and primary health care, reassuring citizens and donors and partners that funding for health is effectively utilized and also protected, right? So in this, advocacy is really crucial to maintain immunization as a priority agenda, to drive institutional reforms that foster national ownership, enhance efficiency, and build more sustainable health system. This aligns very well with the Lusaka agenda and the broader health financing reform agendas. And specifically, strong advocacy is really needed to focus attention on domestic resource mobilization, as has been mentioned already multiple times today. Currently, half of South Sudan's health expenditure comes from external sources. So budget advocacy is really essential to increase public financing for health, elevate priority of primary health care, and ensure that immunization is fully integrated into broader health strategies and then broader, financing strategies in the country. And achieving this, I think this was also touched a little bit already, is that this would require building very strong collaboration and partnership, between health and finance, the ministries of health and ministry of finance. And this is really vital for effective budgeting, financial management. There also needs to be a lot of focus and increased capacities and technical assistance in public financial management, adoption of tools for budgeting and reporting, capacity building of health managers. These are all really critical steps towards greater self-reliance. So I think ultimately, maintaining the strong external partnerships, with donors, while in parallel, really proactively strengthening the domestic health systems, domestic financing. This will all be really key to ensuring South Sudan's immunization program really remains robust and sustainable in the future.
Thank you. That balance is very important moving forward. Thank you for mentioning that. Last question. I want Professor Duok. I want you to summarize for us. What are the prospects of things improving budget-wise in the coming years? From your perspective as we move forward.
Thank you. We can't predict what is coming in the future, of course, but it is our hope that in future things might change. You bring and engage people who understand what they're doing. And what I want to recommend to our people in this country, government and private collaboration should be encouraged. And like we said, there must be advocacy to enable people to understand how money can be raised for vaccination. In case the government doesn't do what is needed of it, they have a lot of priorities, then especially the public who are engaged in helping the people. Usually, if you have the social society that can shoulder some of the things that are not being done by the government, they can even write a proposal that can be brought to the parliament. And we will be ready. We are lawmakers. We don't allocate money, but we are lawmakers in the sense if there is a law to be enacted and it is good for the country, we will do that. And if we get proposal, for instance, on vaccination and other things that need funding, and that it becomes a law, like now we passed the act of a new institute of public health. It was a big debate that we need something like CDC. Now it is in place. We want it to take effect. We want it to take care of health of the people. If there is a motion or something written by the public and other institutions that can come to the parliament, it can easily be made into a law. But we are hopeful that as we go along, things will change. And mind you, we with the climate change, we expect a lot of things, including the things like COVID coming back or anything, Ebola, whatever it is. People must be ready for it. And if the governments are not listening to the voice of the people, there must be other ways of doing it by resource mobilization in their own ways, and might be to keep talking to people or the organization like Gavi and so on and so forth. We are hoping that the people must learn a lesson from Trump, that you cannot have your health invested in hands of other people. Why are you not doing your own?
These are your people. If you cannot take care of their health, who else will do it? Thank you.
Thank you, Professor. Great point. Yes, so things will change, as you said, and maybe slow. And I think it's all our duties to advocate for this together. Thank you for summarizing that for us. That brings us to the end of the questions that were shared in advance. I think we are going to open it up to Q&A session. There's some questions I'm seeing on the chat. One question is, what is CTAC doing in regard to providing National Ministry of Health and perhaps policymakers evidence on the need of not only introduce but also sustain, provide surveillance, and reinforce vaccine uptake based on their recommendations? Looking at the issue of reluctancy in funding on part of policymakers, I guess, Dr. Betty, you talked a bit about this. If you want to take this question from the audience.
Okay. All right. So I think that's the question from Lucera.
Yes.
Sure, that's how he pronounces that name. And so what we are talking about here, I think the focus here is the issue of evidence. Evidence. And I think I mentioned earlier about strategic investments, which are actually cross-cutting across the health system. And one of the strategic investments is actually improving regulatory capacity, because this will increase trust and confidence in vaccines, which unfortunately is not happening much now. Looking at the issue of evidence that the NITAC has to generate, because I said earlier, their role is to provide evidence-based recommendations. That means they have to generate some kind of evidence. Now, in order to generate evidence, the NITAC is supposed to conduct researches and do field visits. Like, they are supposed to conduct their own studies to see if the conditions out there actually allow for introduction of vaccine X or vaccine Y or that kind of thing. And there should be visits. Like, we know that there are necessary structures for the vaccines already existing in the field. You have the vaccine storage facilities, you have the cold chains, all that stuff. So ideally, they should be going there as well to assess their capacity and that kind of thing. Now, unfortunately, because of the issue of limited funding, most of the roles and responsibilities that the CTAC is supposed to be doing, they are not doing it. And one of those critical roles is the issue of researchers. They are not doing that. So how does it generate the evidence currently? What we do now, the evidence is actually limited to desk reviews, mainly position papers from the World Health Organization, recommendations from the strategic group of experts on immunization, recommendations or studies that are done by the regional NITACs, and check for information at the NITAC Resource Center. And if there are also research papers out there, those are the things that we look at. But generating evidence, like from the field, we can't do that. And that is because of funding issues. Like, we have limitations. We don't have a budget anyway, so we can't do anything. I hope that answers the question from Lucera.
Okay, I think I'm seeing two hands. Lucera, if you have a follow-up to this, maybe you can go, then we go to Dumba. Lucera, you can unmute, please go ahead.
Yes, yeah, thank you so much for the opportunity. Yeah, just a follow-up question. I think my concern was that, as Prof was telling us already, they have a challenge in terms of funding because most of the parliamentarians do not believe that vaccination is something, and even health as a whole is something not very important to really invest so much in. So I still feel it is part of NITAC to make sure that they be able to generate at least information, basic information on what we are doing in regards to vaccination. What are we doing? How is this benefiting our people? And how can we best support this to increase the benefit that we are already seeing? And I think if this is done to some extent, it may motivate our policymakers and perhaps the national ministry to be able to provide some funding for these essential services that is an integral part of health that actually plays a greater role in terms of income generation. When we look at vaccination alone, it is not just a service, but also is said to be one of the important income saving service. So if we really convince these people, they may be able to provide us some funding. That is my concern. Thank you.
I actually get your point loud and clear, but unfortunately, it's actually some kind of a vicious cycle. We need evidence to convince them. Unfortunately, also the NITAC is like some kind of a regulatory body that was formed by the government. So ideally, the government should fund the NITAC. And if you have to generate evidence, you first need to make investments. You just can't generate evidence like walk into the field. And it doesn't work like that. It doesn't work like that. You have to put in the money. You have to invest in a system in order for that system to generate results. So if you create regulatory bodies just in name, and you fail to put in the funding to improve their capacity, like there's nothing much really that regulatory body can do for you other than looking into their computers to collect information here and there. So I think that actually fits very well into the adage that says garbage in, garbage out. If you put nothing, don't expect to reap something from nothing. And that's the point I'm trying to drive home. Yes, we have the capacity to do the researches, but we need our capacity as the NITAC to be strengthened first before we can do those activities initially. Because once you are able to generate the evidence, you can use that same evidence to mobilize for more resources from other sources of funding. But the initial money, where is it supposed to come from? It is supposed to come from the government. Unfortunately, it's not there. And this is a challenge that we're working on. Hopefully in the future, when we're able to tackle it, we can be able to generate the evidence required to convince the policymakers that they need to put more funding into health and especially into vaccines. But until we reach that point, we can only collect evidence from whatever is available and present it. And I think that's the point I'm trying to say. But your question is genuine and it's actually on point.
Thank you, Betty. Thank you, Dr. I want to give the opportunity to Dumba Samuel. If you could ask your question, then Godwin after that.
Thank you so much for the opportunity. First of all, I would like to thank Sswim for organizing this session, and the panelists also for making to the session. The topic is very interesting, vaccine funding, though it is narrow. I think the whole thing is all about health financing, and subsequently it all rounds to strengthening health system, particularly the financing, the health financing component of it. From the panelists, what I've gotten here is that we have two issues that I've noted. The issue of allocation of funding from the government is too low, is reducing. Secondly, is the issue of management. the little finance or the little budget that is being allocated. So to me, my submission is that to strengthen any of these health system building blocks, whether being financing or whatsoever sort, we need to first of all strengthen the governance pillar. Because if we look at this allocation, that means there's a little bit of low political will in terms of allocating a reasonable amount of finance for health based on those other declarations that we have, those of professor talked about. So people are aware about it, but still the will is very low. So we need to advocate for that increment in the allocation. That is number one. Two, and then we also need to focus on the management component. Once budget is allocated, we need to ensure accountability. Is there proper accountability for the money that is being allocated? Those are the two things that we need to focus on. Therefore, I want to summarize here by saying that for any other health system strengthening efforts, whatsoever filler within the health system building blocks, I do think that if we don't put people at the center of that effort of health system strengthening, those people can be the policymakers, one category. The people can be the health managers, maybe in the Ministry of Health, health providers, and then the clients themselves, the citizens. We don't put this at the center of any health system strengthening efforts. I tell you, all is going to end up in a very disappointing way. Look at what is happening now. Because we don't have the political will, the advocacy from the policymakers, we don't get the right resources. Even if the little one we get is still being mismanaged. You see, the human resource Dr. Betty talked about, we are changing vaccinators from time to time. The same resources, the little are being used for training, continuous training of people because of exiting, because of attrition. People leave works because of low payment or incentives. So if we invest in those people, the human resource as well as being part of the people I talked about, I think we're going to reduce some of the unnecessary cost that would have been saved for other services. So I think that's my submission. My question here
Thank you.
is,
Yeah.
yes, my question now goes to Professor Adwok. Based on what he said earlier on that the perception with the policymakers about health being handed to NGOs, now given the current context in funding cuts, do we expect some changes in the perception of the people in the August House or the policymakers? Thank you.
Thank you, Dimbo. Professor Duke, do you want to take this? Okay. I think, Dumba, thank you for your submission. It is important to look at the health system in totality, that you can look at one piece at the end of the day. But I think this builds into the bigger picture of looking at how financing influences, especially immunization influences the system. But at the end of the day, you have to consider the system as a whole for that to work. Yeah, I think Adwok, when you're online, you have a question from Dumba. I'll give you that opportunity to answer, but our time is running. I'll take this opportunity to Dr. Godwin, if you can share your thoughts or questions.
Hi, Kenneth. Hope you can hear me. And thank you for organizing this discussion. Look, the issue of financing vaccinations or immunization systems, which is a core component of primary health care, is extremely important. If we cannot get essential vaccines, which is the basic, it's the most basic for our populations, then we are failing as whether as policymakers, duty bearers, or whatever it is. Look, South Sudan is a population, let me put it at 15 million. There are issues with population. If you look at the birth cohort for a year, it's under 1 million. Now, if you look at the resources you need to buy, say BCG vaccine for birth cohort for 1 year, is under $500,000. What is stopping the country from spending $250,000 to buy BCG vaccine as a goodwill? For me, it's a core issue. It's a fundamental accountability issue that we have never addressed. And I hear from Professor Dwok that this is it's the government's responsibility. It's everyone's responsibility, including us as citizens. But how do we meet the basic requirements? How do we meet them? If you look at South Sudan, our out-of-pocket expenditure, the data might not be accurate, but it's at about 50%, 54%, the last reported figure. That means most households spend money out of their pockets to go to private facilities, or whether it's public and private, to get health services. So the money is out there. So one thing we could do is the private-public partnership. If you look at all the clinics in South Sudan, Juba, you go around, most people go to private clinics. Is there a will for the government to partner with private providers to subsidize cost of preventive services? We should not look at private providers just as source of revenue, because what is happening is all we need from them is they get their certificate, they pay their dues, they're good to do whatever they want to do. No, let's look at them as partners in the provision of essential health services. If it is an opportunity for us to work with private providers to increase financing for essential health services, including vaccinations, let's work with them. I would like to see a system in South Sudan where the private providers come forward and say, you want us to increase the reach in access to vaccinations, give us the cold chain equipment. We will provide these services free of charge for clients who come to us at no cost. These are some of the innovative things that we will need to introduce for South Sudan to increase uptake of services. But the really problem is we need to go to basics, the political will. Let us show the will that we can procure vaccines on our own, not leave it entirely in the hands of donors to do it. They can do it for us, but for how long can this happen? We've seen this crumbling under our feet. So my question would be really, how can we effectively nudge our governments to begin showing commitment in the procurement of vaccines from domestic resources? There are other innovative mechanisms that have been mentioned here, but there are basic things we can do at almost no cost.
Yeah. Thank you, Dr. Godwin. Yeah. And I somehow remember, Dr. Godwin, that some of these initiatives, I think, was it with HIV programming intervention, started sort of that public-private partnership, which I think could as well work in immunization. Thank you for sharing that as well. I think that's a bigger question that you have mentioned, is how do we nudge the government so that we see this increase that we all hope for to move forward. I think that's a question that we should walk away with, and that is our responsibility, each one of us in our different roles, to do what we could to advocate and nudge whoever can make the decision to increase budget and allocation to immunization and vaccines procurement. So I think this brings us to an end, sort of to the Q&A session. To the panelists, I want to give you half a minute each to sort of wrap up if there's any takeaways that you want the audience to walk away with. If you can also hint on that last piece from Dr. Godwin, how can we nudge the government to do more? I'll start with Laura Elsama. If you have any last comment that you want to share, then we can. Thank you.
Thank you very much. Dr. Godwin actually hit the nail on the head when he said, how do we then, perhaps present this to potential donor, the government and policymakers and etc. But I think the crucial bit here is, how do we then translate complex data into very simple messages, or make people who are not into the medical field really understand the terms. So basically creating compelling narratives and visuals that communicate the value of vaccination to policymakers, the public and stakeholders. And all of this is an effort aimed at increasing domestic investments. I think that's the crucial bit. We can talk about how we want to keep advocating, but if we don't make that very, very clear to government and all the other stakeholders, they will not see the value at all. So I think using all the health economics analysis would be essential. And I also just wanted to leave this by saying that, health economic analysis can provide really, really good, compelling evidence that immunization is not just a health intervention, but also a valuable economic investment, justifying increased domestic investment and demonstrating a strong return on that investment. Thank you. Over to you.
Thank you so much. Dr. Betty, have a minute too. Okay, go ahead.
Actually, there was a question from Godwin. I don't know if he has given up on that. Godwin, shall I still try to give you an answer, or I just skip it?
You can, of course. Feel free. Unless you want to let it go.
Should I let it go?
You can use the 30 seconds to make the submission. Yeah.
Yeah, because I don't think it's polite just to skip questions like that from the audience anyway. Yeah, so let me try to give you an answer to that, because it's mainly talking about sustainability of the gains made from already existing vaccines when we're introducing new vaccines like the PCV. Actually, it's PCV and Rotavirus, because we recently introduced 2, and we are going to introduce Mpox as well very soon. Now, the thing is that introducing new vaccines actually does not affect the sustainability of already existing vaccines, because for the previous vaccines, we have already secured the funding. You remember, if I talked earlier about the first question was actually about sustainability and affordability of vaccines, and we did touch a bit. I did touch a bit on financing, and I did mention that most of the vaccines we have in country are actually funded by Gavi, and this funding also from UNICEF, WHO, and the government, plus other partners here and there. So literally, those vaccines, the funding for them has already secured. The problem is now what needs to be considered is the long-term sustainability. Like, are we able to continue getting that funding in the face of the changing donor landscape and the fact that Gavi has already introduced a co-financing policy? And that's why we are all sitting here discussing anyway. And putting aside the issue of procurement and logistics, like buying the vaccines from the company and bringing them into the country, one of the things that the NITAC considers in its evidence recommendation process is the implementation strategy. Now that you're bringing these vaccines into the country and you have already secured your donor, how are you going to implement them? And actually, most of the vaccines are simply incorporated into the already existing vaccine supply chains and implementation mechanisms that are existing within the country. And that's why I said earlier, sustainability is not affected. It can only get affected when funding cuts come in, and then that doesn't only affect new vaccines, but it will affect the old ones as well. If you lost funding for BCG, for example, we'll have no BCG, and then all the gains, like the 78% coverage, will come to zero, right? And that applies to any other vaccine. So what I'm trying to say,
and that's my problem, Betty.
Yes, and that's exactly why we are saying we need to secure funding, and the most stable funding we need should be coming from the government. And I think that's why we're sitting here today trying to convince Professor John Odwok that as a parliamentarian, he really needs to advocate on our behalf. But also as NITAC, we need to engage our colleagues from the Ministry of Finance that we need money, and the most stable money should be coming from government. And because governments are there to exist, the governments don't disappear overnight like donors. They are there forever. So they need to give us money. Now, I hope that answers your question. And to conclude, I think I have to thank everybody here for bring up this important topic for the webinar. It's really a juicy topic. I enjoyed the discussions and the comments coming from the panel. So as a final comment, what I want to say is that the issue of vaccine funding is really critical and cannot be underestimated. How we put it, the point is it cannot be underestimated. Like we cannot afford to lose children to vaccine preventable diseases, something that is within our control. We need to buy vaccines. That's the simple thing that we need to do. And these things are predictable. So why should we allow stockouts to happen and children to die? That's not acceptable. That's not acceptable at all. So I'd say to the policymakers, and we have a dog here, I'll say thank you for your efforts. We know you're doing your best trying to push those guys there, but also your hands are somehow tight based on the description you gave us on the processes happening there. However, I still encourage that you people should put in more effort. Like you shouldn't give up. You'll put in more effort to ensure that vaccines are funded and immunization activities are sustained. We cannot afford to go back to the stone age of having polio outbreaks, TB, you know, those things. I think it's not acceptable. Even God will not be happy. Even the devil himself will not be happy. So we need to really exert more effort on that. Thank you so much.
Thank you. Thank you, Dr. Betty. Anika, 30 seconds.
Hi, yes, I'm not going to take up too much more of your time because I think my colleagues here have had a very interesting and, strong discussion already, and probably have brought up all the points that can be made. So maybe the last comment is, I think that every single person in this call, listening in, in the world has a role in advocacy for immunizations. We are just so saturated by the evidence we have on immunizations. It is the most cost-effective public health intervention. It is a best buy intervention. The data is immense, right? So we already have that basis there in our advocacy. And I think now it's utilizing that advocacy to key policymakers, decision makers at every single level. And everyone from, donors to mothers and fathers and children can have a role in making that advocacy effort to make sure that the voice is heard on the need to prioritize vaccines, right? So, and I think that because it's so tangible, it is very clear what the ask is, making sure that Gavi co-financing is paid on time, because, in turn, Gavi now contributes additional funding to cover the full cost of immunization programs. This is a really important factor to make sure traditional vaccines are paid for, to ensure no stockouts happen. These are very tangible and things that can be very easily measured and hold our partners and governments accountable. So I would say utilize what we have available, and there's so much already available, and really advocate at every single level, ensuring that advocacy is not only to health stakeholders, but really our counterparts here has to be our financing stakeholders and those that make the final decision on releasing and allocating funding towards health and vaccines. Thank you.
Thank you so much. Finally, Professor, if you could, your submission, final submission, 30 seconds.
Thank you very much. Professionalism, where people are, whether they get paid or they don't get paid, they are responsible for the lives of others. Number two, Minister of Health. And during my tenure, while Sudan was one, we managed to employ 4 consultants in every big hospital so that they don't go to Khartoum for trivial things. And I gave them 3,000 dinars at the end of the day, at the end of the month. And if they spend 2 consecutive years on the station, they are given a high purchase car. Now, let's see the difference. We are an independent country.
and many doctors employed. As we speak, some of these young graduates are not employed. And then you cannot take care of all the people in the South. Some need to go to other towns. And therefore, the mistake or the problem is with us, the people. While in the old Sudan, there was no problem of vaccination. Happening these days. As we speak, there is no government drugs in the hospitals. The vaccines are lacking, and so on and so forth. We had wanted to build on this, except for Honorable Riek Gaikuk. He did very well when he was a Minister of Health, and we praise him for having qualified or made our young doctors to qualify for further studies, especially in Ethiopia and others. And they are now the anchor of health service in this country. Anything else is history. Nothing is happening. So I want us, all of us, including us in the parliament, like Sister Betty said, we are trying our level best all the time. We want other branches of the government to try their level best. We have a bloated government, over 30 ministers, 650 parliamentarians, and you can see, if these things, there is equitable distribution of resources, we will be able to buy vaccine and we'll be able to help our people. Thank you very much.
Thank you, Professor Peter. Appreciate. Thank you so much to all the panelists and all the audience for your attention and for the questions and engagement. This brings us to an end of the webinar. And from my side, as the moderator, I end here and hand it over back to Dr. Emily from Sswim. Thank you.
Thank you.
Yes. Thank you so much. Thank you so much, Dr. Kemish, Laura, Anika, Professor Dwok, Dr. Betty, and everybody else in the audience. Dr. Godwin, thank you for joining us. Dr. Lukere, Dr. Dumba, and many others who I managed to come in, others opt off.
For a woman, Sswim.
I need to mute Prof. Yes, but thank you very much, everybody, for making this a success. Your interventions, your submissions have been thought-provoking, and we really, really appreciate. We will be crafting a report for all the webinars at the end of the month and should be able to share them along. That's why we ask people to register, so that then we can retain their emails and they will receive it, and so will the speakers and the moderator. And with that, this was supposed to be our third webinar, but we sequenced it as the second. And so we will have a third webinar on Monday next week, same time, 2 p.m. to 4 p.m. cut. And if you're wondering what the title of that webinar will be, we will be discussing what immunization should be like beyond mothers to a shared responsibility, because there's this thing that when somebody talks immunization, what flashes in the person's mind is that it has something to do with a child and a mother. So how do we foster a shared responsibility and community engagement in South Sudan regarding immunization? You want to learn more about this? Show up on Monday. We will be sharing the details this evening, and we look forward to seeing you then. And then the final part 4 of the webinar will be on Friday next week too. And that will be now about empowering the front lines, strengthening the healthcare workforce for robust immunization programs under the theme, how do we champion health? How do we equip and empower South Sudan's healthcare workforce for robust immunization programs? So that will be on the 18th of July, and we hope you could still spare time and join us. So thank you again for having joined, and we look forward to seeing you then. Now, as part of the last, just those of you who saw the ritual we did at the end of this, we would really want to just have a screenshot of everybody who is here. And so I will request each of you, if your bandwidth allows, to really just switch on your cameras, and then I'll do a screenshot and we call it a day.
You're going to ask some of us put on makeup, no? What is this, Emily?
Let me okay. All right, so I want to, the view is multiple speaker. Gallery view, am I able to pick everybody? Good, I can see everyone. Ping, please unmute your, please switch on your camera. I want to capture you. Please, I want you to smile, put on your best smiles. Those who are able to, okay, I don't know why this is showing. That's better. Okay, thank you. That's it. I've done the screenshots. And have a good evening, good morning, and good night. And see you on Monday or Friday next week.
All right, bye.
Goodbye.
Thank you.